Hey, this is Dr. George Moricz. Today's exciting discussion, the POST Covid Tuneup, finally explained so that you and your family can get back to enjoying life again. So what's been in the news? So many people have been bombarded of what to do, what not to do. This has less to do whether you're vaccinated or unvaccinated, because really what has happened is there's kind of a silent complaint, something that's showing up to doctor offices all across the country. It's a great question, and it's the one that I'm getting asked all the time. So the number one thing that people are asking about is, hey, what is this post-COVID syndrome? Or if you've been vaccinated, the post-vaccination syndrome. There are reactions in the body, the immune system, that are furthering the quality decline in your life. So many people are coming to me, and the big question that I'm getting asked and saying, hey, Dr. Moricz, I had COVID and things are still lingering. Or if they had the vaccination, and this is happening, they have what we call a post-vaccination syndrome. Some people are complaining about lack of energy. Other people have a lot of brain fog. They can't focus. They can't remember things. Others have sleep trouble. And then still other people have everything from joint aches to actually difficulty even in their breathing or some chest discomfort. They have what we would call kind of a silent hypoxia. In other words, typically when you don't get oxygen in the body, certain things that we're measuring are obvious. We're looking at how much oxygen saturation you have, and a lot of people are getting that check saying, oh, my O2 saturations are this. They have their vital signs checked. But things like COVID don't really present in the same way. It can be a little more silent, so the numbers look okay. And that's the reason that this very aggressive approach initially with intubating people, putting a tube down your throat and heavily ventilating you had actually worse outcomes. What happens when a virus attaches and enters is a little beyond the scope here, but understand this is a virus. I'm going to make it a little simpler for you. For years, people came to me with what we called chronic fatigue syndrome, or they had been infected with a virus of some type, and so they came with what we called a post-viral syndrome or chronic fatigue. The details of how it affects their life is not as important as the concept is that you feel like a zombie. You're very, very sluggish. Your body doesn't recover. Your immune system is suppressed. Night and day is confused. What is happening is the same with all these syndromes. In another way, we've all heard of traumatic brain injury. We've heard a lot through the NFL and other sports where people have concussions. We've heard about people who've had strokes. What's happening in all of these events is there's dysregulation in the brain. The fancy term is hypothalamic dysregulation. There's a control center in the brain which regulates releasing hormones, which then affect your hormone organ release. Okay? Put differently, think of it like you have all these little factories in the body, and they're supposed to make these natural, youthful chemicals. But what tells them to release? Well, in many cases, the brain, the command center, kind of the CPU, the head computer, is telling your body to release these natural, youthful chemicals through these hormone factories. So you have a number of hormones and peptides we can talk about. We have scores and scores of hormones, and to date, we now know there's over 70,000 peptides. Think of these as chemical signalers. There's other things you hear about like cytokines, growth factors, and many of you are even asking about stem cells. But the bottom line is you have all this cell communication, okay? So cells are communicating, and the signals from the brain, the releasing hormones, the stimulating hormones, the signals are disrupted. Whether you have a head injury, okay, whether you have a stroke, or you have some kind of post-viral syndrome. And as I said earlier, whether you've had the vaccine and you fall in this category, your doctor's told you you have a post-vaccination syndrome, or you have post-COVID syndrome, regardless, there's usually some disruption in the brain. So people say, well, Dr. Moricz, why as a hormone, peptide, regenerative medicine doctor do you get involved in this? Well, the reality is you need someone who understands, who has the expertise of all these chemical signalers, how they affect each other. And the brain being the releaser, the control, that has to be reset. So even clients of mine who came, they're on a youthful blueprint, they're on a roadmap, and they're getting all their hormones and peptides corrected, all these youthful chemicals corrected, they then suffer the insult of any of these things that I've talked about, but especially related now to post-COVID, because this is the hot topic. What happens is I retune them. I go back and I remap them, and I produce a new blueprint for them. And once they do, everything starts coming back again. Their sleep gets better, their energy gets better, their stress response get better. Most of them start metabolizing fat better, they hold on to muscle. When you're in an inflamed state, what happens is you're living on sugar and you're living with inflammation. So adrenaline is the thing that's driving you crazy. It feels like you're still suffering with this same viral response. It's almost like you're still suffering with this same COVID type syndrome. Your body doesn't know that whether you've cleared the virus, it's still suffering with this. So the good news is that once you get the understanding of this, is that it's a brain dysregulation. What will happen at the level of a regular doctor's visit is you may be offered a lot of different things. They might even tweak your thyroid or say, oh, you need a little more sex hormones. Reality is that until you remap the control centers, which ultimately means you get a blueprint. This is what I do with clients. I remap, I do a map. It's not trial error, it's not see how it goes. A warning sign. When you go to your visits and you're saying, well, this is what you're stuck with, this is what's going on, or we're just fix a few things or try this and that. That is really not the right answer. That's like if you take your car in for service. Yes, they're going to check tire pressure, your oil pressure. They're going to make sure that, if you have spark plugs, that things are firing correctly. But if the ECU, the computer chip in your car, is giving the wrong signals, if from the O2 sensor, it's the way that you're releasing emissions, the efficiency of it, if the feedback is not being programmed correctly into the computer, the ECU, the chip, then that computer can't tell the engine what to do. It cannot precisely tell how the oxygen, fuel, and the spark are mixed so that it's inefficient. And the way that cars are designed, they're very, very complicated. They're not simple. And the more and more you learn about automobiles and modern technology, it's a lot computers. It's a lot of computers. Well, the brain is the same way. So from years of experience, and I was seeing it more in stroke, and then understanding expanded to traumatic brain injury, and now this post-COVID syndrome, which really to me is chronic fatigue viral syndrome. It's all the same basket, and the good news is that once I retune the blueprint, I'm able to get the correction of what's supposed to be produced by your hormonal factories, the release of your peptides and signalers. We're able to balance out the inflammation, which then resets it. But right now your body's inflamed, you're running on empty, you're in emergency mode, and you've got to decide how much further you want to do that to your body metabolically. So let's just say okay, look, I'm not doing as much, I'm home, things are okay. The problem is metabolically, your body is taking a whacking. It is disrupting your metabolism, your leptin signals. So your feeding is different. and you won't be able to metabolize correctly. Your satiety signals are different, the way you rest at night, and so you're not going to be able to metabolize food the same way. And I guarantee you with simple certainty, if someone's following your lipids, if someone's following the way that your sugars metabolize, and I'm not just talking about somebody just checking one or two tests saying you're not diabetic. Look at your girth around your midsection, okay? Look at your feeding. Look at your ability to withstand stress, especially 2 or 3 in the afternoon. Look at your consumption of pick-me-ups, things like 5-hour energy drinks and coffee. And I will assure you that it's the disruption in the central processor in the brain. This is hypothalamic disruption. So the good news is that you get this reevaluation on board, and then you can go back to start enjoying things like you did years ago. Hey, this is Dr. George Moricz on Post Covid Syndrome, and hoping that you're getting to be happy, healthy, and looking to help you retune your youthful blueprint. Thank you very much.